We are into the live, sir.
Thank you very much.
வணக்கம் அன்பர்களே. இன்று விஜிஎம் அறக்கட்டளை மற்றும் பாலக்காடு தமிழ் ஆராய்ச்சி மையத்தின் சார்பாக நடக்க இருக்கின்ற இந்த மூளையை பற்றிய கருத்தரங்கத்திற்கு உங்களை வரவேற்பதில் பெருமகிழ்ச்சி அடைகின்றேன். மூளை என்பது எங்கே இருக்கிறது என்றால், அனாட்டமி ப்ரொஃபஸர்ட்ட கேட்டா பிரெயின்ல இருக்கு அப்படிம்பாங்க. So the mind is a function of the brain. The brain is an anatomical structure, whereas the mind is a physiological structure which you cannot see. So அந்த மூளையில ஏற்படுகின்ற ரசாயன மாறுபாடுகள் நமது சிந்தனை அலைகளாக வெளிப்படுகின்றன. அடுத்தது இதயம். இதயம்னா என்ன, மூளைன்னா என்ன அப்படிங்கிறது, இதயம் எங்கே இருக்கிறது, ஹார்ட் எல்லாத்துக்கும் தெரியும். அந்த ஹார்ட் வேற, நம்ம மனசுல இருக்கிற அந்த இலக்கிய இதயம் என்பது வேறு. So அது மாதிரி there are so many controversies where all these unseen, non-dissectable structures are there in the human body. That's why it is a myriad of challenges. So நான் ஒரு 30 ஆண்டுகளுக்கு முன்னால ரோட்டரியில 1993ஆம் ஆண்டு உடுமலையில மூளை பேசுகிறது அப்படிங்கிற கருத்தரங்கத்தை ஏற்பாடு செய்திருந்தேன். அப்ப பேராசிரியர் பி ராமமூர்த்தி அவர்களை அழைத்து ஒரு நாள் முழுவதும் எங்களுடன் இருந்தார்கள். காலையிலே பொதுமக்களுடன் கலந்துரையாடல், மாலையிலே மருத்துவர்களுக்கு வகுப்பு. மிக அழகாக நடந்தேறியது. அது நடந்துட்டு இருந்தப்ப என்ன பண்ணோம்னா, நாங்க we had ஆல் இண்டியா ரேடியோ கோவை வானொலி நிலையம் ஆல்சோ டு இன்டர்வியூ ஹிம். ஸோ அப்ப அந்த ஃபங்க்ஷன்ல திடீர்னு ஒருத்தர் எழுந்துச்சு கேட்டாரு, சார் இப்போ ஹார்ட்ட கூட டிரான்ஸ்பிளான்ட் பண்றாங்க, லிவர் டிரான்ஸ்பிளான்ட் பண்றாங்க, கிட்னி டிரான்ஸ்பிளான்ட் பண்றாங்க, மூளைய டிரான்ஸ்பிளான்ட் பண்ண முடியாதா அப்படின்னு கேட்டார். உடனே அதுக்கு ராமமூர்த்தி சிரிச்சுட்டே சொன்னாரு, ஈஸியா பண்ணலாமே, அது என்ன பெரிய கஷ்டம், மூளை டிரான்ஸ்பிளான்ட் பண்றது ஈஸி. ஆனா நீங்க குப்புசாமியோட மூளை எடுத்து ஆறுமுகத்துக்கு டிரான்ஸ்பிளான்ட் பண்ணீங்கன்னா ஆறுமுகம் நேரம் அவர் வீட்டுக்கு போக மாட்டாரு, நேரம் குப்புசாமி வீட்டுக்கு போயிருவாரு, பெரிய குழப்பமே ஆயிடுமே அப்படின்னாரு. எல்லாம் ஒரே சிரிப்பு. So the brain is one of the poorly understood organs, and people say, all the pundits say we use less than 1% of our brain during our lifetime. So if we can use 100% of our brain, how much of efficiency can it generate அப்படிங்கிறது ஒரு மிகப்பெரிய சப்ஜெக்ட். சுவாமி விவேகானந்தர் போன்றவர்கள், ஆல்பர்ட் ஐன்ஸ்டீன் போன்றவர்கள் எல்லாம் விஞ்ஞானிகள். மேடம் மேரி கியூரி, இவங்க எல்லாம் அந்த they are all probably they have the cosmic energy inside them to drive their brain to make wonderful inventions and philosophy, whatever. So there are a lot of stalwarts in different fields who are all exponents in their own fields. So அந்த மாதிரி ஒரு ஆர்கன் பத்தி பேசுறதுக்கு 2 தலைவர்கள் இருக்காங்க. மெய்கண்டான் சார், அவை நடராஜன் அவர்கள் வழித்தோன்றல், அப்புறம் ராமானுஜன் சார். 2 பேரும் நியூரலாஜிக்கல் எக்ஸ்பர்ட்ஸ், தேர் பிரெயின் எக்ஸ்பர்ட்ஸ். இன்னைக்கு it's going to be a fantastic feast for all viewers and listeners. So இது இந்த பிரசன்டேஷன் மணிப்பிரவாளத்துல இருக்கும், ஆங்கிலத்திலயும் இருக்கும், தமிழ்லயும் இருக்கும். ஸோ தயவு செய்து முழுமையாக இதை கேட்டு கண்ணுற்று இன்புறுமாறு உங்கள் அனைவரையும் அன்புடன் வேண்டிக் கொள்கின்றேன். ஓவர் டு பேராசிரியர் ராஜாராம் அவர்கள். ஐயா அவர்களுடைய உந்துதலாலே இந்த மாதந்தோறும் இந்த பாலக்காடு தமிழ் ஆராய்ச்சி மையம் மற்றும் விஜிஎம் அறக்கட்டளையின் நிகழ்வுகள் நடந்து கொண்டே இருக்கின்றன. சோ பேராசிரியர் ராஜாராம் ஐயா அவர்கள் தமிழ் ஆங்கிலம் 2லும் சரளமாக பேசக்கூடிய ஒரு பேச்சாளர். அப்கோர்ஸ் மலையாளத்துல கூட நிறைய ஃபேன்ஃபேர் இருக்கு அவருக்கு. அவர் இந்த இரு பெருமக்களையும் அறிமுகப்படுத்தி அவர்களை அழைத்து இந்த முழு நிகழ்ச்சியும் நடத்தி கொடுக்குமாறு அன்புடன் வேண்டிக் கொள்கின்றேன். வணக்கம்.
நன்றி மருத்துவர் மோகன் பிரசாத் அவர்களே. போற்றுதலுக்கும் பாராட்டுதலுக்கும் உரிய நரம்பியல் வித்தகர் மருத்துவர் ராமானுஜன் அவர்களே, மதுரை வாழ் நரம்பியல் மேதை அண்மையிலே மறைந்த துணைவேந்தர் ஔவை நடராசனுடைய இளவல் என் இனிய நண்பர் மருத்துவர் மெய்கண்டான் அவர்களே, இந்த நிகழ்ச்சி இங்கே நடப்பதற்கு காரணமாக இருக்கின்ற என் கெழுதகை நண்பர் மருத்துவர் மோகன் பிரசாத் அவர்களே, மோகன் பிரசாத் குடும்பத்தினரே, பேராசிரியை மேனாள் கல்லூரி முதல்வர் பேராசிரியர் கீதா அவர்களே, இணையத்தில் இணைந்திருக்கின்ற சான்றோர் பெருமக்களே, தமிழ் அன்பர்களே, மருத்துவ நண்பர்களே, அனைவருக்கும் முதற்கண்ணுடைய வணக்கத்தை தெரிவித்துக் கொள்கின்றேன். First of all, let me introduce to you Dr. N.D. Ramanujan. Dr. N.D. Ramanujan was an associate of late Professor Dr. Krishnamurthy Srinivas, who was a colleague of late Dr. Dr. B. Ramamurthy of Madras Medical College. Those days, people say Madras Medical College. Now it is a different name. And he was a close associate. He is an MBBS and from Madras Medical College, MD Internal Medicine from the same college. And he is now working in voluntary health services started by late Dr. K.S. Sanjeevi. And he is a resident of Mylapore. He is a Mylapurian for last 65 years.
Yeah, thank you.
His niece is the late Dr. Rangachari, who used to travel by flight to treat patients. His niece is his mother-in-law. And he is an expert both in neurology and cardiology. Very rare combination. He treats cardiological patients, he treats neurological patients. His CV, that his profile is outstanding. Published in Who is Who of Delhi, from Delhi establishment. So he is a legend, and he has undertaken to travel US and Canada, and a versatile teacher, and a PhD guide, life member of so many medical associations. I feel extremely glad to introduce you Dr. N.D. Ramanujan, a stalwart in neurological field, still practicing in voluntary health services. Recently, I just saw in today's Hindu a drug called lecanemab. I was talking to Dr. Ramanujan, and about this Dr. Yennapadam Krishnamurthy, son of late Dr. Krishnamurthy Srinivas, has given some statement. He used to treat with this lecanemab, about which there is an article in today's Hindu from the UK journal. Then I feel extremely happy to introduce to you my good friend, Dr. Maykandan, truth finder, brother of late Dr. recently expired Dr. ஔவை Nadarajan, Vice Chancellor of Tamil University, eloquent speaker. I used to call him Srinivasa Sastri, silver tongue Srinivasa Sastri. He was silver tongue Nadarajan. And this Maykandan is a rare stalwart. He is an MD Pediatrics and DM Neurology. A very rare combination. I have not come across anybody who is an MD Pediatrics and DM Neurology. And he retired as Professor and HOD of Neurology, Madurai Medical College. He has undertaken foreign travels, Paris, France, China, Switzerland, Spain, Egypt, Malaysia, Singapore, Hong Kong, Thailand, whatnot. Presented papers in prominent journals. Life Achievement Award by Dr. MGR Medical University. He has received Lifetime Achievement Award. Exponent in scientific Tamil. That's very important. His book titled Maruthuva Muthukkal has received the Tamil Nadu Tamil Development Directorate Award. Maruthuva Muthukkal. He did training. He underwent exhaustive training under Dr. V. Thiruvalluvan, my friend, Vice Chancellor of Tamil University, and neurolinguistics. I'm extremely happy to introduce Dr. Maikandan, and we are here. Both of them are here to entertain us. They are participating in the talk show. When I telephoned to Dr. Maikandan, he immediately agreed without any hesitation. Recently retired from Chennai after doing the obsequies and all that of his reputed and illustrious brother, Dr. Avai Nadarajan. Then immediately I phoned up Dr. Ramanujan. He said, I can talk in English, I'm not very comfortable in Tamil. You can do anything as your choice. And now I feel extremely happy today. Today is a neurological day. Today is also the 11th, that is December 11th is Bharatiyar festival going on very well in Chennai, arranged by Vanaville Cultural Center, Chennai. So with these few words, let me what you call complete my talk about these two great, in fact, I will call them legends in the particular field. And I will now request Dr. N.D. Ramanujan to inaugurate and give an eloquent talk. Can we prevent neurological disorders? Thank you very much.
Yes.
Over to Dr. Ramanujan.
Yes, sir. Thank you very much, sir, for your kind introduction. And today's topic is insights into the mysterious realm of the human brain and the nervous system for a healthy living. So under that, I'm given the topic, can we prevent neurological disorders? First, I'll start with introduction. Respectful Chairman and Managing Director, VGM Hospital, Coimbatore, Dr. VG Mohan Prasad, Chief Medical Gastroenterologist, Senior Neurologist in India, internationally renowned neurologist Dr. Maikandan, former Professor of Neurology, Madurai Medical College, and other dignitaries and august colleagues among the audience. My pranams to my father, Dr. N. Devanathan, PhD DLit in Sanskrit. Then my heartfelt pranams to my guru, mentor, friend, philosopher and guide, late Professor Dr. Krishnamurthy Srinivas, a doyen of neurology, and his close friend, Professor K. Rajaram, Director, Tamil Cultural Research Center, Palakkad, Kerala. I said my Professor Krishnamurthy Srinivas is guru and friend. He used to instruct like a guru and inquire like a friend. That's why I said both. And I am thankful to all for giving me an opportunity to give a talk on prevention of neurological disorders, which I will describe in the following manner. In these modern days, stress, commonly called tension, is a factor that largely plays a part in the causation of neurological disorders, both primarily and secondarily. So, the diseases that are apt to mention here under this category are, first I will take up 11 diseases. Tension, headache and migraine, then dementia, then meningitis, bacterial including AFB, viral and fungal, then stroke, hemorrhagic stroke, trauma to central nervous system, then multiple sclerosis, genetically determined myopathies, organophosphorus compound exposure, then alcoholism, and lastly, drug abuse. First, we will take up tension headache. Should be analyzed by a clinical psychologist by giving counseling and relaxation therapy. Sources of stress should be corrected. Biofeedback and acupuncture are the modalities suggested. Meditation and yoga therapy are also suggested. I am talking non-pharmacological. Over-the-counter medications for chronic period contributes to headache, which should be avoided. Then coming to migraine, prevention can be done by maintaining good quality sleep, neither excess nor under, and timely food intake should be maintained. Caffeine intake should be reduced to 1 per day. Then a diet diary should be kept to avoid whichever diet causes migraine. Then comorbid conditions such as anxiety, depression, mania, and social phobias, which can aggravate migraine, should be adequately treated by a psychiatrist. Then coming to dementia, which is a memory loss of significance, which are of different types, among which Alzheimer's disease and vascular cognitive dementia are important. First, we will take up Alzheimer's. In Alzheimer's, the adverse factors such as diabetes, hypertension, dyslipidemia, elevated calorie and fat intake, low vitamin B12 all play a part in the development of Alzheimer's, which if attended to will prevent the same. The other beneficial factors are moderate alcohol consumption. If you tell this to a lower economic, socioeconomic group person, he will go into the excess level. So that should be maintained as a moderate alcohol consumption. Then education. Higher the education, lesser the incidence of dementia. Then intellectual leisure activity. Then physical exercise is the most important one. Then consumption of fish and polyunsaturated fatty acids all are factors that prevent Alzheimer's disease. Then coming to the vascular cognitive dementia, which is often due to multi-infarct dementia, due to uncontrolled hypertension or diabetes mellitus or dyslipidemia, or embolism from neck vessels or heart, which should be promptly treated. Then third is meningitis, bacterial, including AFB, viral, and fungal. Nowadays, the incidence of meningitis in general is less common due to preventive measures taken by the corporate and government. The proper personal and environmental hygiene must be observed meticulously, such as hand washing, wearing masks, and social distancing also play a part in the prevention of meningitis other than the spread of COVID-19. The respiratory infections should be treated properly with antibiotics wherever indicated. Stroke, then fourth is stroke. Stroke is paralysis of one side of the body and often occurs commonly due to uncontrolled diabetes, hypertension, alcohol, and smoking, which are preventable if drugs compliance is adhered to. Then hemorrhagic stroke is often due to trauma, which can be prevented, and sometimes spontaneous hemorrhage can occur. So prevention, then sixth is prevention of trauma to head by wearing helmet and wearing the seat belts can prevent spinal cord injury while traveling in vehicles. Then seventh is multiple sclerosis. It is a disease with waxing and waning neurological semiology, otherwise known as remissions and exacerbations. Typically occurs in young persons who are otherwise healthy. This disease occurs in clusters above the equator of the Earth towards North Pole, which suggests that there is a strong environmental factor playing.
और इलायची एक पैकेट और लौंग एक पैकेट आप ज्यादा नहीं लिए जितना लिए हैं उतने हम निकाल रहे हैं
Somebody is talking.
ये हुआ है अच्छा तो मैं एक पैकेट आप लिए हैं उतने हैं.
In the eastern part of the world, it is less common owing to genetic differences in the ethnic groups. These are under research study. Then eighth is genetically determined myopathies, which are preventable with genetic counseling, especially Duchenne muscular dystrophy. Gene therapy is also advised. The ninth is organophosphorus compound exposure, which is very important which occurs during administration of pesticides in the agricultural fields, home, and other places, and the absorption of pesticides can take place through nasally, topically, and oral ingestion due to accidental contamination or suicidal tendencies can produce neurological deficit. This can be prevented by wearing proper aprons, masks, and gloves during administration. Alcoholism, then 10th is alcoholism, which is by prevention of consumption of alcohol in excess, which is very common among the lower socioeconomic groups. Some patients are called alcoholics, which means that they drink excess, lands with medical complications, getting arrested by the police, and lands in court of law. They are called alcoholics. And the one medical complication of alcohol consumption which is necessary to mention is the occurrence of Wernicke-Korsakoff psychosis, which is due to vitamin B1 thiamine deficiency, which occurs in alcoholics, and it is irreversible if left untreated. If detected earlier, B1 vitamin can be replaced in large doses, at least 100 milligram, intravenously with usual precautions in all alcoholic consumers. Lastly, drug abuse or dependence is a major factor in the society. The psychological dependence or addiction, craving, and drug seeking and physical dependence of the complications can occur. The psychostimulants are also used for drug dependence. Sedatives should be prescribed with caution, especially in the elderly. Sources of drugs trafficking sold illicitly should be curtailed. So, with this, I conclude by saying that prevention is better than cure, and much research study is going on in different parts of the world for the prevention of curable and incurable neurological disorders. I hope the outcome of the research brings some beneficial results in the future. With this, I conclude, and I thank my wife, Mrs. Indumati Ramanujam, and daughter, Srimati Anakashri Ranganathan, for helping me in preparation of this manuscript. Thank you very much.
Thank you, Dr. Ramanujan. Your talk was entertaining and enlightening and very informative.
Thank you, sir.
Your vast experience, you exhibited your vast experience. And on behalf of EGM Foundation, Coimbatore and Palghat Tamil Cultural Research Center, I extend my hearty thanks and devoting your valuable time. Sunday, you are busy, you are on your heels. So I thank you once again.
The voice is interrupted.
Request Dr. Maran of Neurology, Madurai Medical College, to give a talk on general aspects of brain functions. Over to Dr. Maikandan. Dr. Maikandan. Dr. Maikandan.
You are able to hear me?
Dr.
Yes, sir.
Maikandan, பேசுங்க. Right.
You are able to hear me?
I am hearing it. Audible. Please,
Okay.
please carry on.
Okay, sir. Okay. I first of all thank Dr. Mohan Prasad for having given me an opportunity to speak on a very important topic, which I love this topic because that's my field. And I chose this field and I wanted to become a neurologist since my age of 30 years. When I saw my sister's daughter who developed meningitis and who died under our nose. That is what he was mentioning. That is what Dr. Ramanujam was mentioning about the prevention. She was my eldest sister. Sister's daughter, when she died, she was only 2 years. She was speaking a few words, very sweet words, until the end of 30 years. She died at the age of 30 years. She was singing the same song, Mannukku Maram Parama, Marathukku Ilai Parama. That song was there in his brain. And she was singing that song, sitting, rocking her body. And she was totally mentally retarded. She was incapacitated. She was dependent on for ADL and everything. And she died of a burn accident. That's a different story. But what made me a neurologist was that how that word was not erased from her brain. And what is that? That is when we were all eating, my sister-in-law was a pediatrician. Abhay Natarajan's wife, Dr. Tara Natarajan, she was my guru, in the sense that an inspiration for her. She was inspiration for my neurology. In the sense that when I saw the case like that, then I just want to know which part of the brain is affected and how it starts like that. And that is how I got into, after becoming a pediatrician, I got into this field of neurology. Then before going into the details of the topic proper, I must really thank Dr. Rajaram, who asked me, you have to speak both in Tamil as well as in English, because he is such a great man in Tamil, which I will not be able to speak in that similar frequency. But I just want to take a few examples. And I just wanted to give you a few anecdotes which I have faced in my practice of nearly 35 to 40 years of neurology. I'm now 72 years old. When I started my practice, probably at the end of 1980, 81, I started my neurology. And I'll tell you, we will start like this. Before that, I wanted to thank Dr. Rajaram, because Rajaram told me, you give a decorum for this meeting, sir. You give a decorum. You have to come with a dress code and everything. So I thought that we will make it as a real scientific public oriented meeting, so that what doctors do not understand about the brain and what the public does not understand about the brain. I'll tell you, I have worked in Ramanathapuram. Ramanathapuram is a small village. It's in eastern coast, surrounded by a few more even smaller villages. But Ramanathapuram people seem to be more intelligent than Madurai people. You'll be surprised by that. Madurai, which was ruled by Pandya kings. Madurai, where Tamil Sangam was there. But Tamil is not there. The Tamil has gone in Madurai. And the educational status very poor, extremely poor. I start with a very, very pessimistic statement, mainly because I just wanted to put it in a forum like this, so that let it go to the public, to the people, and to the doctors, that we are dealing with the public who are all absolutely innocent about what they are. Yesterday, I saw by 11 o'clock, I attended a very important a royal profile marriage at Madurai. And I came back by 11:15, and I received a phone call from a hospital.
Your voice is not heard. Sir? Not audible.
I just want to talk to, you are able to, you are, thank you, I'm sorry, it's wrong number. Sir, you are able to hear me? You are able to hear me? I'm not able to hear you, sir. You are able to hear me? Yeah, it's audible.
Audible.
Yeah. The problem is that we had a small current cut, as usual. What is happening in Madurai? So I'm sorry for the small mistake happened in this communication. Now I'll come back to the knowledge, initial knowledge about the brain of the doctor as well as the public, so that we should know how we can communicate with them. Now I'll come back to that. You will be very much surprised to know that even human body, people were not aware of the parts of the body for several years. Say by 1st century, 2nd century, when Galen started the anatomy. Even then, the brain was not understood. Nobody knew where brain is. Now we'll come back to our ancient history in Tamil. You say in Sangam literature, you take Tirukkural, you get up till the 12th to 14th century, 12th century, 10th to 12th century. No book, there will be no word about Mulai. Mulai, a word is not found in Tamil literature till Manika Vasagar in 12th century. He takes that word. I don't know. So probably by 9th century, probably he belongs 9th to 10th century. Before that, probably they would have started using the word Mulai. People were non-vegetarian. People were initially hunters-gatherers. They were killing the animals. They have dissected a few prisoners and people victimized. But they have not seen, they have seen the brain probably. They have seen a part, something like a jelly-like structure. But they have not understood what it is. People knew about heart more or better than brain. Even the word was not coined for that organ. And it was coined later and has come only in Tiruvasagam. I'll give that word. You'll be surprised how brilliant he was and how correctly he has told about the brain and the nerves, which even in 2022 November, December, we are not able to understand what is brain and what is a nerve. I'll tell you that. He says, மொய்ப்பால் நரம்பு கயிறாக. By united ways, the nerves become a thread like. மூளை என்பு தோல் போர்த்த. This is the first time he says not only என்பு தோல் போர்த்த உடம்பு. He says மூளை என்பு தோல் போர்த்த. குப்பாயம் புக்கு இருக்ககில்லேன். கூலிக்கொள்ளாய் கோவாயோ. இறைவா, please take me. எப்பால் அவர்க்கும் அப்பாலாம் என்னார் அமுதேயா. அப்பா, நான் ஆசைப்பட்டேன் கண்டாய் அம்மானே. This is what he has written in Tiruvasagam. In Tiruvasagam is the only literature, only Bhakti Ilakyam, where he has mentioned about Mulai. Now we will come back again. 2022, you ask a patient where Mulai is. I'm sorry, sir, I don't know. I know about heart, it is here. And I don't know about Mulai. Mulai, ஏமா தலைக்குள்ள இருக்காமா, கையில இருக்கா, கால்ல இருக்கா தெரியல சார். தலைக்குள்ள என்ன இருக்கு சார்? நீர் இருக்கு சார். I don't know what is happening to the school education. They talk about left ventricle, they talk about right ventricle, they know about aorta, they know about valves at all. The brain, they don't know. Why I want to make this very clear, that we are dealing with public who may not know what is brain. Say, for example, when a patient comes with a stroke, you tell him that he has got a brain, he has got a problem in the head. He will not accept it. No, he is throwing convulsions or he is having weakness in the arm and leg, and you say the brain somewhere, some other part of the body. If somebody has got a pain and numbness over the leg, you tell him that we have to take MRI or CT over the back. He will ask why you are taking CT there. You at least you have to touch there and see. So they may not even know how the nerve goes, what exactly the function happens. So it is not that it is not their fault. It is the fault of our education system, where probably slowly people have to come to know, probably next generation. You'll be surprised, even people in the computer technology may not even know what is what. They will say, I have taken only maths and I have not taken science. This is what is happening. So if you tell them something and at the end something bad happens and the relatives start blaming the doctors, there is a reason behind it, because he has not understood what you have told. So it is very important you should tell them what is brain, what are the structures of the brain, and which part of the brain controls which part of the body, and how do you get a sensation, a pinprick at the tip of your finger is felt at the left parietal lobe. Like that. Now, all those things have to be explained in a very, very simple way, so that he will understand. I'll just tell them in a very simple way. You put on a switch here, the fan runs there. So there should be a wire like that. Now we'll come to the word Narambu. For a long time in our generation, we thought the blood vessels as Narambu. Even now, the IV injection which is being given is called Narambu Usi. You cannot give an injection over the nerve. You give an injection over the nerve will get paralyzed. So it should not be called as Narambu Usi. Well, it has come into the field and it has gone into stay. Let it be. Or let them know that Narambu is not exactly Narambu Usi. It is only Ratta Kodai Usi, Ratta Nala Usi. We can make it like that. So like that, they may not even know what exactly we are dealing with as far as this system is concerned. Because gastroenterologists, they know what is stomach, what is intestine, what is colon, everything they have understood. They even know about all liver and spleen. The reason is that liver because most of them are alcoholics and they all have come to know about the liver. And the spleen, and Manniral, they know about it because they call it as surety. And they think that it is full of blood. And non-vegetarian people know very well about spleen, better than doctors actually. And like that, you know about orthopedic people and all those other systems. People have come to know about it very well, except central nervous system, which has started being known after Vesalius and later part of the people. People have come to know about it. I will give you a small history how they learned that the brain has got thinking. Because even now, as the
There is some problem.
ஆமா
Not audible.
ஆமா நாட் ஆடிபிள்.
Not ஷிபு சொல்லுங்க. ஷிபு
சொல்லவா? இதே கரண்ட் இங்க ஏதோ ப்ராப்ளம் இருக்கு, போயிட்டு வந்துட்டே இருக்கு. சண்டே அதனால சடார்னு போயிடுது. இப்போ
Now it's audible. Sir.
இட்ஸ் ஆடிபிள். Okay. I was talking about the world, and the Mulai is a word which has come for a long, in a later part of the century. And people have come to know about it because they say Mulai is a word which has come mainly because it is Mulai. When a plant comes out, the first Mulai comes. That is how they have seen. They have seen the spinal cord as a root. A lot of roots are there, like a plant. They have seen. They have seen the grown up part, and they called it as Mulai. It became Mulai. So at least they have understood something. They have lived with the nature, and they have given the names for that. So that is how they have known. And I was telling about the heart. They say, I love you by heart. That's what people say. Nobody says that my brain is full of your love. Nobody says that. They knowingly that love is only a part. It's an emotion of the brain. Well, it is okay. It is there for a long time, and I'm trying to connect through my system. Yeah, it has come. Yeah. So problem.
to see that.
Yes, sir.
Mandircha. Yeah, correct point, sir.
சரியா இருக்குங்க. கனெக்டிவிட்டி இல்ல.
இல்ல நல்லா தெரியுதா சார்? So we will we'll go to the, I don't know what has happened to the Zoom.
Sir, you can open the slide, sir. Your Zoom is visible, sir. Just open the slide, sir. Your screen also visible, sir.
It's not seen in my, yeah, it is seen.
Just open your presentation, sir. It's enough, sir. We can able to see your screen, sir.
Presentation. My God, something has gone wrong. Sir? Yeah. Yeah, you're able to see.
Yeah.
That is how it is. Before going to the slides, sir, I thought that I will go into the small initial aspects of the introduction about the brain and all. That because of that, the problems we face in dealing with the disorders is something which is tremendous. To make patients understand what exactly is happening. Now, when the patient is throwing convulsion, there are only 3 yes. Professor Ramanujam was telling about several conditions. I always make it very simple that there are only 3 yes in neurology: stroke, seizure, and somatic complaints. That's all. Only yes, 3 yes. The stroke is the commonest problem which we face very commonly, mainly because that the commonest cause for stroke instead of calling it a stroke, I will make it as paralysis, is mainly because of hypertension, diabetes, smoking, previous heart disease. You just remember all these 4. Control your BP, control your blood sugar, no smoking, reduce alcohol, and of course, lifestyle modification. That is enough to prevent a stroke. That we will discuss about it little later. Before going into that, I just wanted to mention a few things about the part of the brain so that they will understand the stroke part. No, I'm not able to get that. The slides part is not coming. Can anyone help me in getting the slides?
Share screen you have to.
Anybody can help me in getting the screen?
Sir, I'm giving request to you. Just share the screen, sir. I'll give the. I'll give the request and I control the screen, sir.
Yeah, sure. You know, he was discussing about thinking, mind, everything. We have thought about it. Thiruvalluvar has written about Manam. He has written about Yennam. Enni Tuniga Karuvam, he says. He knows about Mananalam Mannuhir Kakam. He has made so many thinking about brain, all those, thinking, mind, all those things. But they didn't know where it is. People think, even now, the psychiatrists deal with an organ which is not seen. Most of the time, no, the organs, it is thought that the mind is supposed to be in the brain. Why I am telling you in this, even after getting this, I'm reaching 73 years, is that nobody has seen any particular part of the brain and say, yes, this is mind. But there are a few parts of the brain which control over the emotional aspects of the brain. Say, for example, there is one, I'll show. The slides have come, sir. Yes, sir. I'll just continue. The only interesting aspect, somebody thought, you know about Descartes. Descartes is the person who said that human beings are different from other animals, mainly because we think. He said, you know, the famous statement is that Latin statement is cogito ergo sum. He said that I think, therefore I am. Now, what does it mean? I live, or I am a human being because I think. That's what he said. So thinking, you know, Greeks, they wanted to make a statue. The statue in the form of a human being. They wanted, they just told the sculpture that you make a statue of a human being. And the sculptor said, what do you mean by that human? You want to make a man or a woman? Or what do you mean by making a statue of a human being? The Descartes said very coolly, I must see that statue and say, yes, this is human. Like that, he said, you know what happened? He made a statue. And that is what shows that it is human. You know, what did he do? He made a statue of a man sitting down, looking and thinking like this. You could have seen that the Greek statue everywhere. That is the statue of a man. So that is what he said. When you say in a man, that means he thinks. Now, before thinking starts, what were we doing? What is happening to the brain? Are we thinking from birth or something like that? No, we are not doing. And in the evolutionary scale also, the animals were doing, they were just living in the form of instincts. And even dogs, which we think that my dog thinks like that, my cow thinks like that, all those things are all called instincts. And human being has got thinking mainly because that an animal can touch an object, but man can touch a star, he said. So that is what thinking is. So that is how the whole philosophical aspect of knowledge on thinking went on, till they wanted to know what exactly in the brain which deals with thinking. Because there are people who lose the capacity to think, create, write, everything. And what is happening? The whole thing started with a particular person called Broca. His patient, he learned, we all learn from the patients. You know, I always say that when a patient enters, you examine the patient. That's what you think. No, the patient is examining you. The patient thinks, how much do you know? That's what he thinks. And that is how things were going. And when we started asking the patient, what is happening to you? He will say something which is not at all related to the brain, but you have to bring it to this. But he knew this is something neurological or something to do with the brain. At least that aspect of the growth which we have had as far as central nervous system is concerned. Another interesting aspect, what Broca found out was that his patient was a normal, gentleman to the core, and he was working in a workshop where there was a bomb. The local bomb they used, there was a bomb inside, and the needle or the real axe of which went through this part of the jaw, just below the jaw, and came out of the skull. And he lived. And slowly he treated his skin with the healing of the wound, applying the ointments, suturing for a few days, and slowly he recovered. But what happened was that he was absolutely not the finished God which he was before. That means that the whole character got spoiled. That means he was, started beating his wife, he started taking more alcohol, he was not interested in his work, and he was doing mistakes in his work and all those things. Then he realized that something has gone into the brain, which caused in the brain, which has changed his personality. So that leads on to the question, what is personality? And the personality is formed by the brain. So that is one aspect. But what happened to Broca's patient was that he developed a stroke on the right side of the brain, and he later died. And he found in his brain, there is in the brain has got several areas in the frontal part of the brain. Unfortunately, the slides are not coming today. There is a lowermost part of the brain, the third frontal gyrus, this lowermost part, that's called the Broca's area, which is absolutely destroyed, and he was not able to communicate well. So he thought this area is something to do with the speech. That's what he thought. So that is how the whole concept of language started. People thought that since then, speech is something which is from the mouth, which is from the teeth, which is from the tongue. Pallu pochuna sollu poidum. Naakku, maunam, all those things they were thinking, but they didn't know that there is one part of the brain which is responsible for your expression. Then only they started learning more and more about the brain, and then several things have happened. And there was one more posterior most area is called the Wernicke's area, where they started learning about particular area which is responsible for understanding what you are speaking. So the language is something which I talk, you all listen, and that you are listening because we all have a common language, and you understand the meaning of it. So that is one area where meaning is stored. So several things have happened, and I don't want to go into the details. And people have understood slowly that language is not simple as we all thought before. We still know that linguistics is the most difficult subject. And he started telling us that when you say something without even subconsciously or without even thinking, you can repeat what somebody says. If I say cogito, you may not even know what the meaning of is, but you can definitely repeat it as cogito. You can write it as cogito. So he said something connecting the Wernicke's area where the meaning is stored. And there is an area called Broca, and this area is connected, and that's called arcuate fasciculus. And that is how things started coming. And the frontal part of the brain, parietal part of the brain, occipital part of the brain, the temporal part of the brain, all those things people started naming it, numbering it, and they started finding out what exactly is happening. Before that, people also understood from the heart, that heart has got some left side and right side. And you will be surprised, our humor, God has created us in such a way that we are all leftist. Your heart is on the left side, your left half of the brain is left half of the heart deals with your whole blood supply of the body, and left side of the brain is supposed to be the dominant brain. The reason being, as Broca said, the area which is responsible for your expression, what you speak, comes from that left side of the brain. And we also found out when left side of the brain is affected, the right half of the body goes down. That is how people have started learning more and more about the language, going, everything, the part of the body, everything. Now I'll come to the structure connecting the arms and all little later. Before that, we will just see what is peculiarity about human being. And we all know till a human evolution. Now we owe a lot to Darwin, because Darwin only said that we are all not humans are all apes. We are only apes. We are apes and primates. Kurangilirundu pirandavan manidan. That's what he said. Now I'm not going to the evolution, but you can see in the development of the body, in utero, from the fetus, from the embryo to the fetus, from fetus to newborn. Even after newborn, the brain grows, the child becomes a complete man only at the age of 2 years or 4 years. You know why? You know why child becomes only when from the four-legged animal, when the child becomes a two-legged animal, when the child starts walking with 2 legs, your brain becomes complete. This is something which is again to be probed into. What is happening between the gait or walking and speaking? And once the person starts walking, it's not exactly he just puts one leg front and the next the other leg front. It is not like that, because you lose your balance so much and you fall. So something else is there in the brain which controls your body to keep it in the erect posture. So the erect posture has got something to do with the development of the brain. That's what he thought. And he compared, Darwin compared the human beings with birds. He said, birds, they can just alight from a climb, from a tree, a branch of a tree, just like that, with 2 legs, spreads its wings and goes in, and comes back and sits exactly over the branch without fall. How does it do it? When we are not able to do it. When somebody falls, when somebody sits like that, what will happen to him? He will fall. And as age advances, the same thing happens to us, and we become ataxic. You know, Coimbatore physician, very popular physician, I forgot his name, very jovial person, no? Rajaram's best friend. He used to say,
Dr. Lakshmipati, sir.
Lakshmipati, sir, exactly, sir. Lakshmipati is a very, you must listen to him. I lost the opportunity because he is one person who will make any medical aspect very simple. He said, I reached Coimbatore for the first time. There was no taxi. I was going here and there. There was no taxi. I became a taxi. He'll say. Like that, you know, you don't know where to go or how to adjust yourself. You become unsteady. It's called ataxia. Now, when you use a word like that, so taxis is something which is very important for the movement of a particular person. Now, when brain commands an organ to do a particular job, it does three things. It's called praxis, it's called kinesis, it's called taxis. All these three things are controlled by the brain. Praxis means that if somebody is asked to take the tumbler, immediately you look at it. The brain must have a plan. Brain does the planning in such a way that our arm should reach to a particular level. Our fingers must flex with a particular weight to control. The obvious weight is immediately judged by the brain, and you take it, hold it, take it, reach it to your mouth. And that planning is done some 300 milliseconds before what you execute the function. So that's called praxis. So initially, the moment you think that particular movement has to be done, your brain gives a plan. The plan will have a sequence. So that part is called praxis. Then you don't go suddenly and take it, or you don't go slowly and take it. You use a particular speed and take it. A speed which is understood by others also. If somebody is asking you to give me that notebook, you take that notebook and give it. If you make it a little slowly, he will say, why are you very slow? Why are you in a hurry? Give it slowly. So there is something which makes you hurry, something which makes you slow, something which makes us optimal. So that should also be there before you execute a function. So that part is called kinesis. When you are not able to do it, you develop a condition, a problem. I'll talk about a disease, a condition called akinesia. It's called akinesia. I already told about ataxia, ataxia. Ataxia means you are unsteady. When you walk like a drunkard, or you walk like a person where you are not able to you are not able to walk without any support. You are no more a two-legged person. You are no more a. Now that is one part. Now I will tell you. You just get the name of the organs, because I am sorry that there is no slide which is coming. I'll tell you cerebellum, vestibulum, which is in the lowermost part of the brain, which is very well developed in lower animals. They are more intelligent than us as far as the taxis is concerned. Okay, so that is that we have got from the lower animals. The next part is the kinesis, the speed with which you understand. You take it, or you are very slow when you take it, and that is done by basal ganglia. That part is called basal ganglia. Ganglia is only the kanu, narambu kanu. You know the cane sugar connected with another cane sugar. There is a part called kanu. It will be exactly like that. It is a collection of nuclei. Now, before that, which I forgot, what I forgot to tell you is that cerebrum, the brain, the frontal, parietal, temporal, occipital, and temporal, the frontal, parietal, occipital, temporal, they have got a two-layer. It's called cortex. That is a gray matter, and that's a white matter. Mohan Prasad was mentioning about the gray matter being used by a very important person, only 10%. And the 90% of his brain he has not used. He mentioned only the gray matter, because gray matter is the part which completely controls our personality, our emotion, everything. That is the head. There are two important Tamil books which I just want you all to remember. is that one written by Sujata, that is on Talaimai Chelagam. And the second one was written by our secretary, our chief secretary, Irayangu. He has written a book called Moolaikul Oru Sutrula. He has mentioned, but unfortunately, they all mentioned mainly the persons who have described how it was, and they went into the psychiatric aspect. For a long time, psychiatrists were the neurologists in peripheral areas. When I went to Ramanathapuram, there was a psychiatrist who was looking after the seizure disorder. The first thing I asked my DHO to change him to psychiatry, and I will be sitting there. And that is how it is. And so that part, even the administrators may not know. So that gray matter and white matter is mainly because you must understand what exactly brain is made up of. Brain is made up of some 100 billions of neurons. Neuron is the basic structure. Neuron has got a head like any cell for that matter. The head has got a nucleus. It has got a branching part. They are the wires. There are some wires which will take the sensation inside, and one wire which takes the command to the target organ. That is called the first part is called the dendrite. The second part is called axon. The axons take the command to another axon. In the first slide, probably it was there. You would have seen multiple electric signals coming here and there. That is what is happening in the brain. The neurons, they are always talking. Say from the 10th week of birth, of creation, what shall we say, in embryo, it starts. Until death, they talk. They were talking. There is no silence as far as brain is concerned. You just keep quiet, you call it a silence. But your brain is very active at that time. When you sleep, you think that you are just sleeping, but your brain is very active during sleep. Sleep has got two important, and sleep is a different topic, sleep and dream. Once we will have a discussion about it. It's a fantastic topic to discuss about. Again, each and every part of the brain has got every function. The frontal part, I told you, no, initially left and right has got a different function. Though they look alike, it's only the mirror image of the other. When you look at the left brain and the right brain, they all look alike, but they are entirely different in functioning. We still do not know how it does it. That we have to find further and further. Because after the identification of the chips, identification of the softwares, we are now able to understand something must be there. There is somebody called it as initially Penfield. He said your memory is stored in engrams. He called it as engrams, E-N-G-R-A-M, engrams. But now we know they are not engrams; they are only chips. They are only chips. These, the one chip of contact can remember several numbers and names. Like that, there are several softwares in the brain. All the softwares are put together and put it in the brain. And left brain mainly deals with language and thinking. Or thinking, I will come to that little part. For thinking, whether language is necessary or not is also very important. Very important question, or very important part to be debated. Without language, will you have thinking? And number two, from the left to the right side is another very interesting aspect, because right side is for mainly arts and music. You will be surprised to know that if you take Ilayaraja and A.R. Rahman, their right brain will be definitely enormously developed when compared with the with our left brain people. We are all left brain. We just talk and we keep quiet. Right brain people are so good in building temples, building great structures, building their imagination is so good. Somebody asked whether left brain is the dominant brain or the right brain. Right brain is a dominant brain, he said. The right brain is very well developed in lower animals. Right brain is responsible for the knowledge of the space. In the sense that you just wake up, you see the area, we know the three-dimensional aspect. And you go to your school, you come back, you don't forget that. You again go to that area and come back. But our human brain has got the spatial knowledge little less. And the மூளை நமக்கு குறைவு. எப்படின்னா, the lower animals, they have got a very good spatial knowledge. They have got a very well developed right brain. You know, your cattle, your dogs, everything, when you send them out, they will go to any part of the city, any part they will roam about, and they will come back to our house correctly in the evening. Birds, they go out in search of food, various areas, take the food, come back to the same tree where the nest is there, and it gives. So that part is well developed in the lower animals. It is called orchicerebellum, and orchicerebrum, and all those things are there, and they all show that we have grown up like that. It is in the evolutionary scale. That is how it is. We have got everything in the brain, which shows that how we have grown. And another interesting aspect of the left brain is that it will make you forget which part is yours. Even in your house, you may forget where your bathroom is, where your bedroom is. You will just get up in the morning, and you will see your bathroom is not there. This type of very characteristic localization is done. I have had a patient who had a problem in the posterior aspect of the occipital lobe. You know what he said? He was sitting in his easy chair, and somebody threw a newspaper behind. He thought that the newspaper has fallen in front of him. He was not able to identify where the newspaper was. But it's called auditory localization. It's auditory you are sitting here, there will be a telephone bell sound. You go there and then take it. You know where the place is. That type of localization, that type of visual-spatial knowledge is done by right brain. That is how things go. Each and every part has been given some job, which has, and coming down the emotional limbic area, the various anger is determined in particular area, and amygdala is in particular area, and all those emotions are all controlled, and the control is done by a few chemicals. All those things we will discuss in due time for want of time. I'm coming down in the midbrain. Is in the middle part of the brain. That part of the brain has got all the nuclei for the ocular movement. When you say, Thiruvalluvar says the kannottam. Kannan beru kannottam. He says the kannottam. But what he really meant was that the kindness which you show through the kind. But our eyes are extremely important, and eye movements are very important, because unlike other lower animals, the eyes are not on the lateral side. So we have to see something on the lateral side. So eyes move, and that eye movements are all controlled by the third nerve, by the nerves sitting in the midbrain. 3, 4, 5 is a sensation. The sixth nerve, they are all called cranial nerves, because these axons come out from the cranium. Now from them, then the facial nerve comes. The next structure is called pons. The pons it's almost like a bridge between two cerebellum. So that is why it's called pons. that has got a structure that is for the lateral aspect of the eye, and that has got the vestibular apparatus, everything. And the next part of the brain is called medulla. Medulla has got several nuclei. All these nuclei or the nerve heads control over the lower part of the mouth, of the face, like tongue, palate. All those nerve supply is done from the medulla. Apart from all these things, from the upper part of the medulla till the midbrain, the internal structure, the structure inside is called reticular formation, which only says that, which only makes us now think and read about it. Listen to me lecture, and it makes you conscious. Now the consciousness is something which is a very great field. Are we conscious now? We still do not know. If somebody is listening to me, may not even understand what I speak, they may be unconscious. You just look at the TV, you'll be just looking at the TV and you'll be thinking about your office work, you are unconscious. Unconsciousness has got three important components called awareness, arousability, appropriate response. So once you lose consciousness, you are coma. My professor KS used to say, sometimes, in the classrooms, most of the boys become comatose. That is what he will say. Like that, when all those things come into the brain because of, you see that all these Aimpulangal, that May boy can move to Sivi. All these come to the conscious area. They come through that area. They all get the branch. From there, they end at a very important structure in the basal ganglia called thalamus. I said thalamus. From there, it gets projected to the cortex, and cortex gives the awareness that something has happened to it. Otherwise, you'll be just sleeping, but you'll know that something is calling you. And only when the cortex commands you, yes, come on, get up, your wife has come. Otherwise, you will be in trouble. So he will immediately get up and go. So like that, you are. So all those structures are all kept beautifully in the brain. Of course, I have not told about cerebellum. Cerebellum, they are extremely, very, very highly developed, sensitive, very sophisticated organ on both sides, which control your stability and whatnot. It controls several things. I'll talk about it later when time comes. And like that, it's such a huge topic which he asked me to speak in a span of a few hours. I think it is very 5 to 12. I thought that I'll finish it off and I'll say the spinal cord has got a few nerves, and how the nerves come out, I'll tell you. And the nerves, when they come out from the vertebral column, it has got a motor nerve, it has got a sensory nerve. They convey the message to the brain, hey, something is wrong. You have touched a very hot butt of cigarette. Hey, this is ice. There's a pin which you have touched, to remove it. So those reflexes, sometimes your brain may not be needed. There will be a reflex action. So that is also a complicated one. Nerves will take the message to the brain, that is sensory. When a message comes from the brain to the muscle, it's motor. And all those things, you see how difficult it is for us to convey to the person who is not very well informed about it. We will be in real trouble when we see them, when we tell them, and they will, when somebody says that I'm not able to understand you, you should understand them, he's right. Because even most of the neurologists may not understand what we are dealing with. And somebody say, I say even delusion, hallucination of the emotion. What you see as delusion, what you see as a hallucination, you see some object. If somebody says there is no object, you are in trouble. Bharatiya's song has got a very, very deep meaning. Nirpaduve, nadapaduve. In that song, he will say, Maya Totrangala. He is such a real thinker. he will say, you know, whatever object you see is not the object what you see. What we have seen is only the image of that object what we have seen, what we have perceived. Because your eyes have taken the image is perceived. There's again a false image. Whatever image which goes into the eye, that is the image which you see. And you think that is Meganda. So the real Meganda's image only you see. So that is why people thought that it is Maya. That is why people, psychiatrists started believing that the whole world is Maya. Because we are only seeing the images of what we see. So you don't have Anavam, don't do this Kanmam, because you are dealing with Maya. That is what elders thought, without even knowing what exactly the brain is, completely. Of course, even now, we are yet to find out how it functions, how it does. One word before finishing it. I just, somebody asked about the brain what is it? Transplantation. Yeah. That they have done that. They did brain transplantation in the form of, it is not completely take one brain and take. In Parkinson's disease, they did the fetal adrenal, because we in the cortex, in the Parkinson, it's only the dopaminergic neurons which they die. So they have taken that nerves, the adrenal medulla part, and they have kept it over the brain. The brain does not accept that. Similarly, they have tried several parts of the brain and keep it in a particular part which is deranged, which is demented, and the brains do not accept. He said about the cellular therapy, genetic therapy. Genetic therapy is something which has come into vogue, which has given some, which has thrown some light on our health, treatment armamentarium. But it is very costly, and we are yet to see, like leukemia, like where bone marrow transplant is done. Brain transplant, or the parts of the brain transplants, are being tried. Even for the spinal cord injury, they have done stem cell therapy. These stem cell therapy and all, they have all been misused. I'm sorry to say that. And hence, that is one problem with the medicine, because the medicine involves the economics also. So it becomes a problem with allopathy. So even the stem cell therapy becomes a big problem. Like that, several things are yet to be done, starting from the fundamentals, to understand the fundamentals, to the management in the form of cellular therapy or genetic therapy. Thank you for the opportunity. Thank you very much.
Thank you, Dr. Megandan. You have given a very entertaining speech. You proved to be very good professor, teacher. And let me introduce Dr. Ramani, a leading general physician in Coimbatore. He has been my friend for last so many years. Student of Dr. Lakshmi Padi, humorist doctor. He has come, and I requested Dr. Ramani. He's a very busy general practitioner in Coimbatore. Whenever I go to Coimbatore, I used to see him for medical checkup. I am his patient, and also he is a good friend of mine, introduced to me by Dr. Lakshmi Padi, now in US. And I thank Dr. Rega, my personal friend, ophthalmologist in Palakkad, Trinity Hospital, veterinary surgeon. And Dr. Pradeep, my friend, neurologist in Palakkad. And Professor Geeta, retired principal, Kerala Government Service. And I thank immensely Dr. Mohan Prasad for organizing the whole event. Without him, the function would not have taken place. And Dr. Ramanujan, who spoke very well, and he is your close associate and mentor, Dr. Krishnamurthy Srinivas, has mentioned, and he was a student of Dr. B. Ramamurthy. That is an added qualification. He spoke very well, and he has been a PhD guide and practicing neurologist in Chennai, voluntary health services, and we all benefited by your lectures. Dr. Megandan, I am really fortunate to listen to your lecture.
Thank you. Thank you.
Son of an illustrious professor of Tamil, Dr. Avvai Durasamy Pillai, who was professor and head department Tamil Tyagaraja College, Madurai, who was a versatile and staunch commentator of classics, Tamil classics. Dr. Avvai Durasamy Pillai, I met, I was a student in Pachayappath College, Chennai. I met him once in Tyagaraja College. And he has quoted Tiruvasayam and all that, and a very eloquent teacher, very eloquent lecturer. So really fortunate. All those people who joined live are really fortunate. And I thank all those people who have joined the online event. And I request, if you have got any doubt, 2 minutes, 2 or 3 minutes, not more than that. Now it is already 12 o'clock. You can just ask Dr. Maikandan and also, if possible, Dr. Ramanujam, if he is prepared. Any doubt, but just only for 5 minutes, not more than that. Because it is 12 o'clock. If there are no doubt, we will close the event. I wait for 1 minute. If there is no response, I will close it.
If there is no doubt.
Also, sir, I wanted to remind you, sir, hello. I wanted to remind everyone that this will be available on the YouTube with the same link you can access it at any point of time. So this will be archived in the VGM Foundation website. So you just have to use the same link, then you can watch the whole program again. So kindly share it with your friends. Two intellectuals have delivered an amazing talks today. So I'm sure it will really benefit our thinking process and understanding of our brain. And I just salute all those stalwarts, Dr. Ramani, Dr. Pradeep, Principal Madam, and all other intellectuals who joined us today. Thank you so much.
Thank you, Dr.
Thank you, Dr. B.G. Mohan.
I
Thank you,
would
sir.
like to inform you that Dr. Maikandan is writing a book for Palakkad Tamil Cultural Center on neurology in Tamil for common people. He is writing a book on neurology.
Yes, sir. Yes, sir. I have started. I will definitely do. Now, I'm sorry for the interruptions which I had. Suddenly, the current went off here again and again. In Sunday, it happens here.
No problem. The slide was not moving. No problem.
Yeah. We will have, when occasion comes, I'll just show the slides. Because I just, where my professor KS used to say, whenever there is no doubt after a lecture, either they have understood it completely or they have not understood you. That's what he will say.
I'm sure the first one applies to both the professors' talks.
Yeah. Thank you, sir. Thank you.
Thank you so much. Thank you so much.
Thank you, sir.
Thank you. Thank you.
Bye, sir. We'll call it a day. Thank you, maybe.
Thank you.
So we close the meeting.
Yes, sir.
Thank you.
Thank you, Rajaram.
Okay. Thank you, Dr. Ramanujam. Wish you
Thank you.
all a happy